these things they can produce effect on every system almost, starting from the organ level, system level, cellular level, and even molecular level. So in the language of biochemistry, if you want to talk about the effects of the stress, it can show the disturbances in the metabolism of all the three important compounds like carbohydrate metabolism, lipid metabolism, protein metabolism, and in addition to this, the other molecules which are involved in the regulation of the metabolic pathways like hormones and even neurotransmitters. You can see the disturbances in the production or activity of all these molecules at different levels, which will result in the deleterious effects of various different kind in different systems. Then it is not only the disturbance at the metabolic level of these compounds which I have narrated. There is also, surprisingly, there is structural damage even is what should I say, documented, like damage to the white matter of the brain affecting the myelin sheath. That is one structural damage which could be resulted because of the stress. And even at the cellular level, it can interfere with the cell division and cell differentiation, and it can even show its effects at the level of DNA, which is part and parcel of DNA replication followed by cell division. At this level also, the effects of the stress are found to influence. Then we are all very well aware of how stress is directly related to the carbohydrate metabolism, particularly because, as I said, following the stress, the hormones that are released is adrenocorticotropic, ACTH, and also the cortisol, and obviously they have got profound influence on the carbohydrate metabolism. So we know very easily, when you look at the hypoglycemic and hyperglycemic hormones, apart from your insulin, every other hormone is hyperglycemic. So these are the structural damages caused by the stress. So here, for the same situation, when some stress is exposed, two different individuals for the same stress, they show a different response. Some will be able to cope very easily with the stress, and some cannot cope with it. They succumb to the stress and they may end up even being depressed. And surprisingly, this vulnerability to the stress is attributed to the metabolic disturbances in the glucose at the peripheral level. And this ability to deal with the stress is defined as a coined or termed as a resilience of the individual. So the resilience, it speaks of the ability of the individual to deal with the stress when confronted with. And this resilience is determined by or attributable to the disturbances of the glucose at the peripheral level, the disturbances in the metabolism of the glucose. As I said earlier, the cortisol is a predominant hormone which is released in the stress, and we know that it elevates the levels of the glucose by gluconeogenesis. And adrenaline or epinephrine, as you all know, that is promote mode of glycogenolysis, and which is also released in excess in times of the stress because of the mood activation of the sympathetic nervous system. And even the cortisol being the stress hormone, that is also going to result in gluconeogenesis, both of which contribute for the elevation of the glucose level. And excess of the persistent rise of glucose, and then in response to that, the persistent rise of the insulin, naturally in the beginning, it can set into a kind of insulin resistance. So, which is a further consequence of glucose levels being raised. And another interesting aspect of this fluctuations in the glucose is persistent raise of the glucose, the hyperglycemia, accompanied by the raised levels of the HbA1c at the level of neuronal tissue. It has been described in one of the literatures that it results in what you call decrease in fractional anisotropy of white matter. So that what it means, it seems to disrupt the interconnections between the tracts, and even the demyelination of the neurons is also been reported in investigations in a case where the subject is continuously being exposed to chronic stress. And in addition to this, the brain is highly in demand of the glucose. 20% of the total calories, usually this is what the demand by the brain for the neuronal activity. And at one end, all the mechanisms come into play to increase the glucose levels to meet the increased demand of the glucose at one end. And brain being one of the organs which is continuously in demand of more of glucose. Ironically, the GLUT1 and GLUT4 transporters, which allow the glucose to transport across the blood-brain barrier, their activities seem to be decreased. So ironically, the blood remains with the accumulated levels of the glucose, where there is a hyperglycemia in the blood, but at the same time, the brain is suffering from insufficient supply of the glucose because the transporters are affected. This is one paradoxical finding which will worsen the neuronal activity. So, basically speaking, the stressful condition will shift the entire metabolism into the hypermetabolic state because there is increased demand of energy to cope with this stressful condition. So, consequently, it switches over into hypermetabolic state. So, even the input, energy substrate input also must be high, and the input of the energy substrate and the storage of the energy substrate and the utilization of the energy substrate. When the imbalance between these three events that will decide which are the that will result in the, that is a cause for the deleterious effects of the stress at different levels of the body. And with regard to the intake, our intake is influenced by these leptins and ghrelins. Leptin is an anorexogenic, you also call it as orexogenic protein, which is produced by the adipocytes, and it acts on the hypothalamus at the satiety center, and it suppresses the appetite. Actually, it is produced in proportion to the adipocytes. More adipocytes formation and more should be the leptin secretion. But at one point, just like the insulin resistance is developed in the presence of a sustained rise of the glucose, in spite of the adipogenesis, there seems to be resistance of even the leptin, and leptin remains suppressed in its activity. Even expression of the leptin is also reduced. But the production of the leptin is also reduced at a point of time. And then, conversely, to meet the demand for feeding more, the ghrelin activity is increased. So the ghrelin is, because the anorexic leptin is suppressed, whereas orexogenic protein, which will increase the appetite, increase the intake, is found to be elevated. So in a patient suffering from anxiety, neurosis or depressed, they are found to eat more. Hyperophagia, you can see as one of the findings in these patients. This is to, one reason is to meet the increased demands of the energy demands, and at the other end, the palatable food, it gives some kind of a mental comfort for them, which makes them keep on eating. So both of which, so in psychiatric patients, this phenotypic behavior is attempted because of this release of all this suppression of leptin and increase of the ghrelin. So, as I said, it is all because of the imbalance between these three events. So, that's about the effect of stress on the carbohydrate metabolism. And when you look at the effect on the protein metabolism, I said to start with, to deal with the stressful condition, body shifts into hypermetabolic state, and which means that it goes more in favor of catabolism. So there is escalated catabolism and there is a suppressed anabolism. So the same thing is happening even in case of carbohydrate and lipids and also the proteins. And when it comes to the proteins, it results in a negative nitrogen balance, which you obviously know. The more the protein that is being degraded in the body is much more than the protein that is being fed through the diet making, whatever it is. So at the same time, here, even if you want to feed more to balance this negative nitrogen balance, the protein synthesis mechanism and the machinery is also suppressed in the presence of the stress, in the presence of these stress hormones. So there seems to be a drop in the level of mRNA production and also the ribosomes. So even if you want to compensate by giving more of protein in the diet, this protein synthesis inhibition cannot be removed until the stress is removed. So this negative nitrogen balance is because of more of protein breakdown at one end and reduced protein synthesis. So more of protein breakdown is because of more of catabolism of lipids as well as proteins. The same catabolism, the breakdown of the proteins to yield glucogenic amino acids to provide more substrates for the glucogenic amino acids that will produce more of glucose. There is a breakdown of the protein at one end, there is impairment of the protein synthesis at the other end. And in addition to this, there is a suppression of anabolic hormones. As I said, its more shift is more towards the hypermetabolic and catabolic state. There seems to be decreased activity of the growth hormone as well as insulin, which are actually anabolic in nature. So coming to the effect of the lipids, the same thing holds good. And you can see dyslipidemia in cases of the stress. It is again because of the imbalance in the intake of lipid and storage of lipid and the combustion of these lipids for energy. There is imbalance in all these three events. And even the lipids distribution, when this distribution is carried out by your lipoproteins, there seems to be decreased activity of the HDL and increased LDL levels, and imbalance between the transport of HDL and LDL of this cholesterol will result in hypercholesterolemia. And in early stages, there seems to be lipolysis, and when the stress persists and continues, when it is long term, that will result in a lipogenic, more of adiposity, so more of visceral fat accumulation, which can again worsen the condition, leading to what you call this metabolic syndrome, which it can what should I say, precipitate into a state of metabolic syndrome. So this is in one glance, you can all see the metabolism of the proteins and the carbohydrates, that is glycogen, and stored fat, that is triglycerides, all being broken down, yielding protein yielding amino acid, and glycogen yielding your glucose, and triglycerides yielding your fatty acids. So there is a catabolism of all the three, which you can see at a glance. So apart from the effect, the disturbances in the metabolic pathway of these compounds, the other aspects how stress can be deleterious is it takes its toll on immunity as well. So when we recall that the stress is being channelized starting from the hypothalamus and then pituitary and then adrenal axis, Consequently, with the release of more stressed hormones, this lymphocyte sensitivity to the hormones is altered at the stress condition, and there is even reduction in the levels of lymphocytes, and also antibody production is also suppressed. And this is what usually we keep seeing when an individual is suppressed. There seems to be suppression of immunity as well. So, in addition to that, the stressful condition also contributes to the autoimmune diseases. The well-known examples of autoimmune disorders like rheumatoid arthritis, psoriasis, and even asthmatic bronchitis. In such cases, when they undergo too much of stress, whenever there is some such episode of stress which they undergo, you can see the acute exacerbation of the symptoms. So it is very much contributory to the symptoms they show in these psychosomatic disorders when they undergo this, and particularly because of the exaggerated immune response. And when you look at the effects of stress on different hormones, the stress hormones that are released, they appear to decrease the activity of thyroid. So, because the thyroid activity is decreased, it will stimulate the TSH. When more of as a feedback mechanism, more of TSH will be released, which in turn raises the level of thyroid, leading to a persistent raise in the thyroid level. Because I said it is body is going into hypermetabolic state, which necessitates more of thyroid production. So when the thyroid production results in a sustained raised levels, that will in turn suppress the TSH levels. And same the cases of some of the cases of hypothyroid, they turn out to be Hashimoto's thyroiditis. This is again example for autoimmune disorder. And this also turns out to be because of the stress seems to precipitate this condition of Hashimoto's thyroiditis, which is maintained because of the stress. And the hypothyroid state and overeating, obesity, one will worsen the situation even much worse. And when it comes to other noticeable ill effect of this influence on thyroid is when someone is undergoing acute physical stress, like in case of MI, when someone is already hyperthyroid, that could even result in a medical emergency, what we call this thyroid storm. That is also noticeable in the presence of the stress. So the parathyroid hormone, the stress hormones, they seem to affect the receptors of parathyroid hormone. So even if the production is normal, when it comes to the action of this parathyroid hormone, the receptors are defective, they are not expressed or they are not functioning properly in the presence of these stress hormones, which is why it is as good as a state of low parathyroid, hypoparathyroid state will result in presence of the stress because of affliction of the receptors of the PTH in their target organs. And it is happening in the presence of stress hormone, like I already told you, the cortisol and adrenaline and all that. Probably I don't know if this is the reason when many patients are treated on cortisol for many conditions, autoimmune disorders and many other allergic etiology cases, probably they tend to be having this osteoporosis when cortisol is used for a very long period. Probably I don't know if this is the reason. So one finding here is the stress hormones, they influence, they alter the receptors, and so that it results in a state of hypoparathyroidism. And similarly, following that, when it comes, even the effect of the growth hormone, as I said, all anabolic hormones are suppressed, and there is more of catabolism. In the same lines, just like insulin is suppressed, and similarly here even the growth hormone is also suppressed. That way, I know still in some of the pediatric books, what we have read in our student days, one of the causes for the stunted growth, the emotional deprivation has been mentioned as one of the reasons the child are found to be with stunted growth. So it has got direct effect on the growth hormone, suppression of the growth hormone. So again, another hormones on which the stress is found to show its effect is the effect on the sex steroids. So as we all know, the cholesterol is the precursor for the production of these sex steroids, androgens and estrogen and progesterone. And cholesterol initially it leads to a precursor what is pregnenolone, which will further be converted to these androgens and also the estrogen and progesterone. But in a chronic stressful state, because the stress response is only by releasing this adrenaline and also this cortisol, there is a need for more of cortisol production, and which will hijack all this even precursor for the production of the sex steroids like pregnenolone. They are also diverted for the production of cortisol. Consequently, it will result in the low levels of these sex steroids. Probably this is the reason when one is stressed out, you can see disturbed menstruation, disturbed ovulation, and decreased libido. These things are very much reported in cases suffering from anxiety neurosis and also in the depressed patients. So this has been already done. What is happening in the diabetes and stress? They are, I can say, they are synonymous. So there is a hyperinsulinemia. Hyperinsulinemia usually it is accompanied by hyperglycemia. So hyperinsulinemia is the first sign of one of the earliest signs of insulin resistance. So to compensate for the insulin resistance, there is an overproduction of insulin, resulting in a state of hyperinsulinemia. So that will again result in hypoglycemia. This is typically, we can notice in patients who are in the early stages of diabetes. They have their lunch, they feel the satiety satiated, but a short while after the lunch, maybe in about half an hour, 1 hour or so, they again feel hungry because of this effect. So hyperinsulinism leading to again hypoglycemia. And hypoglycemic state is a stressful condition which can activate the sympathetic nervous system, which will again end up in causing hypertension because of the vasoconstriction that is caused by the sympathetic nervous system. And insulin sensitivity is affected because it is directly proportionate to the adiposity, and for the reasons that have been explained earlier, one will put on more of weight and more of adipocytes and then more of insulin resistance. And another contributory factor which will worsen the diabetes or which makes one precipitates diabetes even in diabetics, non-diabetics is because of the hyper-metabolic state, there is a more of hyper-inflammatory response also, and which can even cause the beta cell damage. And there seems to be down-regulation of the genes which are even responsible for the beta cell production. So diabetes, either predisposed or the existing diabetes, is very much worsened because of all these reasons put together. So by treating a case of diabetes, stress factor can never be ignored. Probably I can say it is the first thing to be looked into before you actually go into medication. So we know there are many of the other psychosomatic disorders where stress seems to be attributable factor. So psoriasis is one condition, and the stress is obviously releasing all these stressful hormones. And in the presence of these hormones, the T cells and B cells and monocytes, they express receptors for these hormones, resulting in the chronic elevation of these pro-inflammatory cytokines like interleukins and TNF alpha. So these TNF-alpha interleukins, when they are produced more, because as a response to the stress, they seem to cause damage to the skin. The skin lesions in psoriasis, because of these pro-inflammatory markers, which are produced in response to the stress hormones by your T and B lymphocytes. So even the same pro-inflammatory markers are found to be high in patients suffering from depression, and usually the concept of depression and the treatment of the depression and then pathophysiology is they seem to have very low levels of neurotransmitters like serotonin and dopamine. And these inflammatory proteins, they seem to alter the metabolism of these neurotransmitters, which probably would be a reason where stress would result in depression. And surprisingly, giving anti-inflammatories in cases of psoriasis, they seem to make the symptoms better, and even depression signs seem to better with the administration of anti-inflammatories. So probably the inflammatory element in cases of depression we need to take into consideration, which are due to the stress produced in excess. So rheumatoid arthritis, for the same reason, which is again one of the entities listed under autoimmune disorders. And in the presence of the stress, heat shock proteins, what we call chaperones, they seem to be produced more, and antibodies produced against these heat shock proteins, they seem to cause damage, resulting in synovitis and destruction of the joint, leading to rheumatoid arthritis. So asthma, as such, asthma directly doesn't result because of the stress, but an existing case, chronic asthma, who is suffering from, in the event of acute stress, there is acute exacerbation of the symptoms. And interleukins and leukotrienes and histamines, which are released as a stress response, they seem to cause bronchoconstriction and bring about a hyper-inflammatory response across the mucosal lining of the bronchus, which makes the condition worse, which is responsible for acute asthma. So another domain which not paid attention much is the stress seemed to have its effect on mitogen activated protein kinase. So the mitogen activated protein kinase is supposed to mediate the external stimulus. So any signal that is generated by binding to the membrane receptors to mediate these effects, biochemical effects, and leading to the production, to bring about the change at the level of genetic level, maybe even for the cell differentiation and cell proliferation and all that. This is mediated in the presence of mitogen activated protein kinase. So that in the presence of the stress, the activity of the mitogen activated protein kinase seems to be affected, so that the normal physiology of when the intended hormone or such things which are meant to be binding to the membrane receptors, it is interfered, and their effect, which should be mediated across intracellular compartment to produce the desired effect at the level of the DNA, is not being produced. Actually, it will, for cellular growth, differentiation and regulation, it contributes. And when the activity of this MAPK is disturbed, it is said that this can even lead to the production of carcinogenesis, because cell differentiation, cell division and this regulation is disturbed, and that is also contributory for the production of malignancy. And in addition to this MAPK, there is another molecule, an enzyme, which is also attributable for the development of the malignancy, indolamine 2,3-dioxygenase. The job of this enzyme is usually keep the immunity system at a low ebb with an intention to prevent hyperimmune response in the presence of some allergen or any condition where the exaggerated immunity is a possibility. In such occasion, to blunt the immunity, to check the hyperinflammatory response, it is done by our indolamine 2,3 dioxygenase. So, in the presence of stress, the activity of this particular enzyme is elevated. There is upregulation of this enzyme, and more the activity of this particular enzyme, lesser will be the immune response. So, immunity is blunted. Actually, when there is a development of the malignancy in the initial stages, the tumor mass, which is recognized like a foreign body, antibodies can be produced against this to cause the destruction of these malignant cells in the initial stage. But in the process of the stress, because this enzyme activity is increased, which is responsible for suppressing the immune response, that will facilitate a favorable microenvironment for the carcinogenesis. So it's no wonder when you come across the case of malignancy, no wonder that stress could be an attributable factor, irrespective of the family history. So that is the underline, irrespective of the family history. So at the level of cellular level, again, when the cell is conventionally undergoing the mitotic division, at the level of prophase, it forms a mitotic spindle so that all the chromosomes can be attached, and then fully, when it is ready to divide, it divides, and then the chromosomes are divided in equal number to be passed on to the daughter cells. So when this mitotic division is in progress, in the presence of the stress, the mitotic spindle and attachment to the chromosomes also will be indefinitely delayed in the presence of the stress, and it may reach a point where the mitotic division can altogether come to a halt, and more it goes into kind of apoptosis, and cell death is also a possibility in the presence of stress. And of course, hyper metabolic state is synonymous with the more production of free radicals, reactive oxygen species. And one of the reasons attributed for the aging, as we all know, it is more production of free radicals. So these free radicals seem to have their effect even on the telomeres. So when the cell is dividing, more the number of divisions takes place, lesser will be the length of the telomere, because the activity of a telomerase is also will be blunted, and this is attributable to damage because of more of production of your free radicals, which is more in the presence of a hypermetabolic state. So all this is nothing but a simple summary of what has been dealt already. It goes into hypermetabolic state. It is more of a catabolism. There is a negative nitrogen balance, and it interferes with the hormones and neurotransmitters production and also their activity. And like I told, paradoxically, there is a high level of glucose in the blood, but less of glucose reaching into the brain. And insulin resistance and visceral obesity, cardiometabolic, and also the pre-diabetic status also will ensue. More sympathetic tone and more of dermogenesis. You can, the person who is very much neurotic, if you give a shake hand, you can see his palm being wet because of the excess of the sweating. So, because of more of dermogenesis and increased metabolic activity, increased sympathetic activity. So, increased glycogenosis, gluconeogenesis, and then energy expenditure increases and respiratory quotient decreases, and there is more of adiposis and hyperorexia, hormonal disturbances and the suppression of the immunity, and mitochondrial dysfunction and oxidative stress. These all at a glance. So, till now, to the extent possible, we have discussed the deleterious effects of the stress. Usually, clinician simply advises when a patient comes, be it a case of diabetes or hypertension or obesity. Usually, the prescription will be given as per the need, as per the very need, anyone will prescribe. But usually, the advice given to the patient is stress tagginchukondi, that's it, not beyond that, not a word, nothing less, nothing more. And when the doctor advises that, the patient even thinks that stress is good. So this is not the way. It cannot be taken for granted. We need to, it is on the part of the clinician to enlighten and educate the patient with regard to the magnitude of the damage that can be caused due to the stress. And stress can be abated by various methods like more of physical activity. The one thing I observed is more active you are physically, less active will be your mind. The racing of the thoughts will be less. More physically active you are. And more sedentary you are, more active is your brain. And another thing is, whatever we are doing, we must be completely indulged in the job at hand. So usually the stress is because of another reason is what we think is different from what we talk, and what we talk is different from what we do. When all these three fall in the same line, absolutely there will be no place for the stress. Because what is doesn't please us, and we run after what is not. So this happens when we thought and word and action are different, and when they are not coaxial, this is what precipitates stress. And when one resorts to meditation, all the imbalances that we have narrated till now, they seem to be reverted. So it activates the parasympathetic system. In acute stress, there is more of sympathetic activity. And once persistently, when you practice meditation, not in a day or two, meditation, the effects of the meditation are cumulative. So the effects can be perceivable maybe after weeks or months. It depends on individuals' openness and perception and what should I say, openness to accept and practice. So it can shift the balance in the autonomic nervous system more towards parasympathetic, and as you all know, there is reduced ROS production, reduced catabolism, normalized glucose levels and normalized lipid levels. There is a raised protein synthesis, balanced neurotransmitters, regularized cell division, and usually in cases of anxiety and stress or depression, all that the cases, all the drugs that are given, they are meant for maintaining the levels of this serotonin. So this serotonin decreased levels is an effect, not the cause for depression. So the decreased levels of serotonin is because of the stress hormones and other pro-inflammatory markers that are produced. They are the ones which are interfering with the levels of this dopamine and serotonin, and the drugs conventionally being prescribed are the ones which are meant for maintaining this serotonin levels. We are dealing with the effect. So to deal with the cause, you have to deal with the stress and the de-stressing mechanisms. I do not deny the need for prescribing these antidepressants, but I have seen many patients for months and years, they are put on antidepressant. The moment they stop using it, again there is a rebound phenomenon, and it goes on and on for many years. So the specific treatment for treating cases of anxiety and anxiety neurosis and depression is one must teach the individual how to respond to a situation. The response to the situation makes all the difference. For the same stressful condition, each of us may respond differently. So the problem is not in the stressful state or whatever condition we are confronted with, that is not the problem. So how we respond or react to it makes all the problem. So this meditation can modulate your response towards the problem, which I feel personally that it is the specific treatment for treating these cases of anxiety neurosis and depression with due apology for my psychiatric friends and colleagues. So the message to be carried is acknowledge the stress in various disorders, and even in case of organic disorders. I am not just talking about the psychological or psychiatric disorders. Even in organic diseases, the stress that is accompanied by physical ailment also needs to be addressed, without which the treatment is not complete. So we need to explore the techniques like meditation, because the moment you say meditation, it is not perceived in a scientific manner. Why? Because what is mind? You know what the brain is, but what is mind? Can anyone define what the mind is? We cannot, because it is not a physical entity. And the moment we realize that it is not physical entity, it doesn't fall in the domain of science. So which is why the meditation is not duly accepted, and it's not acknowledged, the efficacy of the meditation and effects. It is not acknowledged properly because it is not physical domain. And anything that doesn't come under physical domain doesn't fall under the domain of science. So we need to go beyond science. It is not just about the body, it is the influence of the mind itself in maintaining the health, or when something goes wrong leading to the disease. And the last but not least is recently I have read a book, what you call Biology of Belief. It is based on the theme of epigenetics. So what they say usually, what we all believe is our genetic makeup is predetermined. We cannot change our genetic makeup. And whoever has got the family history of diabetes and dyslipidemias and hypertension, we feel that we are very much bound and we are very much prone to develop these at later part of our life. But